What did you say? Can you repeat that? If you found yourself asking those questions, you might want to stick around for this episode of Being Well. Our guest is audiologist Dr. Tena McNamara from Speech Communication Disorders at Eastern Illinois University. We'll talk about all things related to hearing loss and prevention. Don't go away, Being Well starts now. Well, today on Being Well, we're talking about hearing loss with audiologist Dr. Tena McNamara. Thank you for coming by the show.
I'm glad to be here.
Tell us a little bit first about where you work at Eastern and what you do.
We have I'm in the Communication Disorders and Sciences department, and within that department we actually have a clinic where we provide services, speech language therapy, but we also do testing for hearing. Our clinic does not dispense or disperse hearing aids, but we do the diagnostic part of it.
Okay,
So.
Tell us a little bit about what an audiologist does and what your schooling is like.
It used to be that audiologists were pretty comparable to, the schooling was pretty comparable to a speech language pathologist. You had to have a master's degree. About 10 years ago, about 10 years now, they changed the requirement. So the entry-level degree to be an audiologist, you have to have a doctorate now.
Okay.
And there's two types of doctorates that they have. They have a clinical doctorate and then the PhD doctorate, which is more research. Clinical doctorate is geared more toward being able to provide comprehensive clinical services, and so most of the audiologists now have clinical doctorates.
Okay.
So.
Thank you. Well, let's talk today about what are the primary causes of hearing loss?
That's a very good question, and it really depends a lot on age. For young children, the primary cause of hearing loss that you'll see is oftentimes ear infection, some type of what they call otitis media, and that's pretty relevant in smaller children. It is true you do tend to grow out of that, but for adults it has a lot to do with noise exposure and age.
Okay, so I love when our guests bring models on this show. Tell us when you have hearing loss, where is it actually happening in your ear?
Okay, and that's a very good question, because once you kind of understand that, then you can relate it a little bit to what types of hearing loss they are and to the population. And if I kind of explain to you how sound travels through the ear real quick, then I'll be able to tell you where the breakdown is. As you can see, here's our model of our ear. Here's your outside, which is your pinna. When sound comes in, it travels through the ear canal and it sets the eardrum or the tympanic membrane into vibration. And what happens then is you have three small bones in what they call the middle ear cavity that actually do kind of a mechanical action. They rotate back and forth. What they'll do then is there is this little, I'm going to pull this out here. It actually looks like a stirrup from what you would ride a horse, but we call it the stapes. It rocks back and forth and it sends some fluid in motion in here in what we call the cochlea, which is your organ of hearing. And then it excites some hair cells. Those hair cells send an electrical impulse to the brain and sound's heard. Now, what's interesting is the tympanic membrane completely blocks off that middle ear space from the outside.
Okay.
And that's what people don't understand sometimes. You also have a tube that runs down the back of your throat called your eustachian tube. And that's what allows some air into this middle ear space. So if that eustachian tube it doesn't function properly, what it's supposed to do is it's supposed to open every once in a while, equalize the air pressure here to the air pressure on the outside. And when it doesn't, then you develop some fluid behind the eardrum.
Okay.
And that fluid builds up, and if it sits there for long enough, it becomes infected and you have a full-blown ear infection. And that's where you hear about kids possibly having tubes put in their ears.
Ask, where are the when you have a child that has tubes put in your ears, where are they actually?
They insert the tube right through the tympanic membrane.
Okay.
So the tube really has two main functions: to let air into the ear to kind of open up and keep that airflow in the middle ear and to drain out the fluid that's in there.
Okay.
Hopefully what will happen is eventually whatever caused that eustachian tube to dysfunction, it gets better. A lot of times it can be like you have a sore throat, you have a cold, the eustachian tube opens up in the back of your throat. Well, your sinuses drain down the back of your throat. You have sore throats, your tonsils, your adenoids. So any number of those things can cause eustachian tube to dysfunction.
Okay. So when you have hearing loss, what part of the ear is being damaged or is damaged?
Well, when you have problems in that middle ear space, that can be called a conductive loss, and that's usually in relation to maybe something's wrong with these three small bones. They don't move like they should anymore, or you've built fluid up behind the eardrum, that kind of thing. Then we move past that, and where I was talking about the cochlea, we have actual hair cells in there, and once those hair cells are excited, they send an electrical impulse to the brain. It's those hair cells that get damaged, and that's when you have what we call more of a permanent sensory neural type hearing loss.
Okay, so we point that out on the
Right here is
model
your
here. It's
cochlea
right
here.
And that's where you hear people of having cochlear implants.
Exactly. And with cochlear implants, what they do is they actually drill a hole through the bone in the back of your head, and they have a wire that they insert through the cochlea, and because those hair cells can't send electrical impulses, the wire now sends electrical impulses.
Okay.
And cochlear implants really are just for those people that have very significant hearing loss, that hearing aids can't help, those kind of things.
So for someone that is born deaf, what part of the ear doesn't work? Are they born with something that's deformed? What causes actual real deafness?
Deafness, there are several ways to define that, and technically in the audiology terms, we talk about people that have very significant hearing losses where they can't hear speech at all. We're talking up in the 90 decibel range. When you're at 90 decibels, that's about not quite as loud as a jet airplane, but it's pretty loud. I mean, jet airplanes get up around 100 decibels, 110. But what happens is a lot of times they're born with damage to those hair cells.
Okay.
Or they can also have damage to, this is the eighth nerve, which sends those impulses to the brain. But a lot of times it's damage in here to the hair cells, to the cochlea. What causes it? It can be, hereditary, maybe there was some type of malformation of the cochlea, during those gestation periods, those kind of things. So it really depends.
Okay, when I was doing my research for the show, I found out that they categorize hearing loss in different levels. Can you talk about what those are and kind of the symptoms of each level?
Exactly. As audiologists, what we like to do is when we do a hearing test, we give individuals tones at different pitch levels, and we see how soft the sound can get where they can still understand it. And then we break it up into mild, moderate, moderately severe, severe to profound hearing loss. So when someone has a mild hearing loss, a lot of times they can still catch speech sounds, especially when they're in a quiet room on a one-to-one setting. But if they get a little distance from the speaker, they'll notice they'll have some more problems. If they get in noisy rooms, they notice they have a little more problems. Moderate hearing losses start to affect some of those speech sounds. They can't pick all of those up like they should. When you get moderately severe, usually you're below the level where a lot of speech sounds are formed. So it's really, you definitely need some type of amplification in order to understand. When you get in that severe to profound hearing loss range, it can even get to a point where hearing aids or something like that may not help, because hearing aids are really limited in the amount of power they can provide, and it may not be able to give you that extra boost that you need to pick up those speech sounds.
So I remember as a kid when the audiologist would come to school and you'd do the hearing test and you'd raise your hand. It seems like once that's done, we don't have hearing tests. So how do you sort of, as if you're sitting there thinking, I don't think I can hear very well, what are some signs that you might self-diagnose yourself with some hearing loss and then move forward to getting a hearing test?
If you have trouble following conversations, if you have trouble hearing speech when there's noise, now that one we talk about quite a bit. You may be able to understand people on an individual basis, but when you get in some background noise, you totally break down. If you notice a difference between your ears, definitely come in. And then there can be some more severe symptoms like that are associated with some specific medical problems, but if you have constant tinnitus or ringing in your ears, if you notice fullness in your ear, if you notice dizziness, those kind of things.
So let me ask you a couple of questions. If you were, as a child, if you had maybe tubes in your ears or suffered chronic ear infections, are you more likely to have hearing loss as an adult?
That's a very good question, because I get a kick out of my students that come in and say, I had ear infections and I was deaf when I was little. And I was like, well, you really weren't deaf. And your hearing's probably back to normal now. It's very unlikely unless the ear infections go untreated, and then they can cause erosion of the ear canal. The infection can get into what we call your mastoid bone. They can cause some erosion of the ossicles, or those three small bones, and those are usually in cases when you haven't received the medical attention that you should. Scarring on the eardrum, those kind of things. So
is aging and hearing loss, do they kind of go hand in hand, unfortunately?
Yes. I always feel really, of course, I'm getting up there in the age now too, so not far from, I have my AARP card and all that, so, but I don't feel so guilty talking to people about that now, but just like all your other functions, vision, things like that, hearing will decrease with age. And how much it decreases just depends on the individual. There's really no way to predict it. But I try to, when I talk to young individuals, I really try to emphasize, listen, if you're 20 years old and you start out with a hearing loss, the prognosis isn't good, and, this may be something that leads to, where you have to wear hearing aids later, that kind of thing. So you protect your hearing now.
Right. So if you work in an environmental area where you constantly, lots of noise, that can lead to hearing loss. Or if you went to lots of rock concerts as a teenager.
Absolutely, absolutely. There is definitely a rise in hearing loss in teens now. They had a study that came out a couple years ago through the Journal of the American Medical Association, and they followed some teenagers about 15 years ago, and then they retested new teens 15 years later, and they found a rise in hearing loss by 31%.
Wow. And I'm guessing, we work here on a campus, and you see, well, adults, but a lot of college students, earbuds in the ears constantly. Is that, that's a common question, will that lead to hearing loss?
Yes, it will. And the problem is that the students don't really realize how loud it is. And also, I grew up in those teen years in the 70s where we had our big speakers in the back windows and stuff, but it was dispersed a little bit. That is directly concentrated into their ears, and that's what they're seeing. They're seeing what happens is when you have noise-induced hearing loss, you have this little notch that starts out. It's called a notch, where one of the higher frequencies start to drop, and then the rest will. And they're seeing more prevalence of this high frequency notch in younger individuals.
How do you know what's too loud then?
It's really kind of a judgment call, but I often tell my students, and I've told my own children, that if I'm walking beside you and I talk to you and you cannot hear me, your earplugs are too loud.
Okay. What about, as we're talking about teenagers, teenage boys, my nephew did the same thing. They like to have those really loud, bassy speakers in their car. Is that type of sound, which it's loud, but it's also very thunderous or whatever. Is that kind of frequency bad for your ears too? Or
All loud frequencies are bad for your ears.
Okay.
Yeah, so it really doesn't matter if it's kind of that bass or that high. And this is why they have a lot of strict regulations in industries now. The Occupational Safety and Health Administration have strict guidelines that these individuals have to follow. They can only be exposed to so much sound over a period of time, and if they are, they have to provide ear protection, those kind of things. And so when you're working like in an industry like that, you have people watching over you, but teenagers, they walk out the door and you can tell them turn it down, but then they just might turn it back up.
Well, and I've noticed in my neighborhood, I notice more and more people wearing hearing protection when they're mowing their lawns.
Yes.
Probably not a bad idea.
It is a great idea. And my husband will, when he looks at this, he will probably shake his head, but he is a prime example. He is in office, he's a superintendent of the school district, never exposed to loud sounds, but we have 3 acres and we have a riding lawnmower. And being an audiologist, we have followed his hearing, and last time we tested him, he started to show that noise exposure, that drop in those highs, and so brought the earplugs home, and it is time, and which he should have been wearing ear protection long before that.
So
before it
for
occurred.
something, as we're talking about that, does it depend, so say it takes you 45 minutes, it takes me 45 minutes to mow my lawn, should I be wearing hearing protection?
I say whenever sound you consider it loud, you should wear ear protection. It's really just a matter of you can get the earplugs at Walmart, Walgreens, CVS. It's a matter of taking some earplugs, sticking them in your ears, pulling them out when you're done, sticking them in your pocket. But hearing conservation definitely is something that isn't practiced as much as it should be, and it's so simple, So anytime you're exposed to a sound for an extended period of time, pull out some earplugs.
So say you go to your audiologist and yes, you do have some hearing loss. Talk about hearing aids, because they've made huge advances in hearing aids. I think there was always this, I don't want to wear one, it's going to make me look old, it's this big thing. Now they're so tiny, can't even see them.
They are, and the trend for a while was the very, very tiny ones that set in your ear, but now they have a new style, and they actually set up behind your ear, but usually what they'll do is they'll match them to the color of your hair, and they're almost invisible, and they have a very small see-through tube that routes the sound down into a little what they call dome that goes in your ear. The sound quality is extremely better. Almost all hearing aids now are digital, so they have an ability to. A big problem with older hearing aids was not only did they amplify the sound around you, not only were they amplifying the sound you wanted to listen to, but they were also amplifying noise. Now with the digital, they have some compression circuits to help ease that noise so you can concentrate on the speech a little more. Now they're not perfect, and it's not like your hearing was, originally, but they are much better.
Can hearing loss ever be reversed?
Not at this point.
Even in young children, young kids?
Not unless it's something medical, maybe more related to the middle ear. Then it can be treated. There's some surgical things, some medications, those kind of things. But when you get into a permanent type sensory neural hearing loss, at this point, there is nothing you can do except for consider maybe a hearing aid or some type of assistive device to hear better.
At what point, there are surgical options available for some types of hearing loss, correct?
Yes. There are some things like, for example, they have what they call bone-anchored hearing aids now. People that have unilateral hearing losses are doing those, and what happens is it's a kind of a little bone vibrator that's implanted in the head, and it takes sound into their deaf side, and it helps to route it over so they hear it with their good ear. So they do have those. They have cochlear implants, but like I said, cochlear implants really are for those individuals who have very significant losses that hearing aids don't help. But as far as any types of I have these hair cells in my cochlea that have been ruined by sound exposure or by age, and they don't function right anymore. There's really nothing they can do to go in and repair those actual hair cells. Now, in the future, possibly, and I mean, they are looking at things like implanting other people's cochleas. There's all types of research that they're doing in that area, but as of right now, if you have a sensory neural hearing loss, your options are you either live with it or you maybe consider amplification.
So at what stage, you talked earlier in the program about the stages of hearing loss, mild, moderate, severe. At what stage do you recommend a hearing aid?
It really depends on the individual, and we talk a lot about this. You might have a lady an elderly lady that's at home, doesn't go out much, and she might have a mild hearing loss. So it would be just maybe figuring out some ways for her to compensate for that in her environment. But then you have another individual who she's real active and plays in the card club and golfs with a group of ladies, and it's really important for her to be out and catch those conversations, and she may be more of a candidate for hearing aid.
So it's a little more lifestyle.
It is definitely lifestyle based. It does become a safety issue when the hearing loss becomes significant enough that they don't hear people speak or they don't hear their doorbell ring. In those instances, those kind of people would definitely be candidates, but it has a lot to do with lifestyle and need.
So how often should we have our hearing tested? I mean, if you go to the doctor once a year, you get your cholesterol, your blood pressure, all that sort of stuff. The hearing just
goes on the wayside.
It just gets on the wayside unless you have a problem.
Yeah, we recommend annually, and I do have some individuals that come into our clinic every year on the dot to get their hearing tested, and that tends to be some of my older patients, because they want to monitor their hearing, those kind of things. But I always encourage a lot of my students right now to get their hearing tested, because I tell them this is a gold piece of paper. 40 years from now, if you have a problem that arises, you actually have some evidence of where your hearing was at once. A lot of times when we see people, we don't see them till after they've already had the problem started. So we really don't have anything to compare it to. So I encourage anybody, get a hearing tested. If you don't have any problems, it's okay to wait 2 or 3 years to have it done again. Come in immediately, though, if you notice a change. If you have a problem in your hearing, get it checked annually.
Let's talk in these last minute or so about some preventative measures we should be taking before it becomes a big problem.
The thing that I advocate the most for is hearing conservation. If you are going to be exposed to loud sounds for an extended period of time, pull out the earplugs. Just try to be real conscious about that. That is the best thing you can do for yourself at this time.
Well, Dr. McNamara, thank you so much. You're our first audiologist on Being Well.
This is great.
This has been very informative, and I hope our listeners, viewers have learned something new.
Thank you.
Thanks
very
for
much.
coming back.
Thank you.
Imagine what life would be like if you lost your hearing. No music, no sounds of nature, no listening to the voices of your loved ones. But some people with profound hearing loss do have options. Cochlear implants in the right patients offer the chance to hear again.
Peaceably to assemble.
I'm an old-time radio fan, and this is what I'm listening to right now. It's called America at War.
That may seem like an unusual hobby
They made the Bill of Rights.
for a woman who can't hear.
In fact, I'm deaf now.
Barbara Daly's hearing started to fade when she was in her 20s. Over the years, it got worse.
I could be sitting right here, and there's a fire alarm right above us, and I would never know it was going off.
But because of the type of hearing loss Barbara suffered, she was a candidate for cochlear implants.
A cochlear implant is a technology for people who have severe, profound hearing loss. It can bypass the damage in the inner ear and allow those folks to hear well.
Shh. Sarah Oakley is a clinical audiologist at Mayo Clinic. She says normal hearing works in this way. Your outer ear collects sound waves which vibrate the eardrum and middle ear bones called ossicles. The vibrations continue into the inner ear where they stimulate fluid and tiny hairs which send electrical signals to the brain. After age 40, our hearing can start to fade. Hearing aids can help, but after a certain point, they don't help because they can't overcome the damage.
In that situation, a cochlear implant is a good solution because it can bypass the damage.
There are two parts of a cochlear implant. The outside part is a little computer that picks up sound and processes it. The inside part, which is implanted by a surgeon, receives the processed sound and converts it to an electrical signal that stimulates the hearing nerve.
There's always that anxiety that it's not going to work.
When the first of two implants was turned on, Barbara heard nothing. Then a crackling noise like radio static.
And then all of a sudden, it started happening. I was actually hearing.
If Barbara takes off her processor,
See, it's just like a hearing aid over my ear.
she can't hear. So Lexi, the hearing dog, helps her around the house to let Barbara know if, say, the oven timer's going off.
What? Show me. What is it? What is it? What is it? Oh, good girl.
Cochlear implants are not perfect, but with implants, Barbara says her world has come alive and she can once again
by the people
listen
of the 13 states.
to old-time radio. For Medical Edge, I'm Vivian Williams.